So Parkinson's disease is a neurodegenerative condition. What does that mean? That means that there is damage to certain parts of the brain, called the basal ganglia, which we do not know what causes that problem. In about 5 to 10% of cases it's genetic, but the other 95 to 90% of cases is idiopathic. This comes out of the blue. We don't know what causes it. If there's a family member with Parkinson's disease, it slightly raises your risk of getting it, but just by a little bit. The cells start to become damaged, and then that continues over time. And we don't have a medication or a drug or any way of curing that or stopping it or even slowing it down. We don't have any of treatments like that definitively at this point in time. So often the often typical first symptoms that people might experience is some tremor, usually tremor in one hand when the hand's resting, or stiffness, slowness, or some loss of balance. Their friends or family or themselves may notice that their voice is becoming a little bit softer, their facial expression is changing, becoming a little bit more masked, so not as expressive as it used to be. They may start drooling, having a little bit of extra saliva. So they're often the first things people notice, or the patient notices themselves. Then other things that can come early on is loss of sense of smell, constipation, sometimes some urinary trouble, urinating a little bit more frequently than usual. And there's a couple of other things too that may happen early, which is anxiety or depression, maybe one of the early things, and just changes in sleep. So, for example, starting to act out their dreams, yelling out in their sleep, kicking out and punching in their sleep is a symptom of Parkinson's. And that can potentially lead to them falling out of bed or injuring their bed partner accidentally. So that's one thing to look for. So when you see your physician, either a primary care physician or a neurologist, there's things that they look for in the history. So in the symptoms that you have that will clue them in that this could be Parkinson's disease, and then the examination will confirm those findings. So it's really a clinical diagnosis, it's history and examination. Your doctor might order some additional tests, such as an MRI scan or a CT scan of the head, and maybe some blood work if they think that's necessary, and that's just to rule out potentially other mimicking conditions. There's also things they'll ask you about regarding medications that sometimes can mimic Parkinson's, but they're the main things to rule out, and then it's really a clinical diagnosis. We don't have a blood test or any other test that will definitely confirm this is Parkinson's disease. Well, there's lots of treatments to help Parkinson's disease. So in the early stages, the symptoms, the tremor, stiffness, slowness, respond really well to medications. Levodopa, so carbidopa, levodopa, or Sinemet is a very effective medication to help those symptoms. And there's several other medications along those lines that mimic levodopa that can have a similar effect. So there's lots of things that can help. And then regarding what we call the non-motor symptoms, so things like constipation, urinary symptoms, mood disorders, sleep problems, and so on, there's lots of medications that can be used to treat those symptoms. So it's very important that you can empower yourself to improve your overall health and overall well-being in terms of how you will interact with this diagnosis. So the things that will help Parkinson's disease are ensuring adequate sleep, ensuring a healthy diet, and exercise. And exercise is almost as good as a medication in that it can help a lot of symptoms and also potentially slow the progression of Parkinson's disease. So that's a possibility, not yet proven. But exercise will help things like improving sleep quality, improving mood, improving constipation, improving stiffness, improving balance. So of all of those things, exercise will get at better than so it's almost like one medication to cover all of those aspects. As Parkinson's disease progresses, the symptoms we talked about, tremor, stiffness, slowness, loss of balance, can progress too. And other symptoms can come out. So problems with memory, problems with hallucinations, problems with speech, becoming more difficult to understand, problems with swallowing. And the things that can get people into trouble down the line is problems with swallowing, so you choke on food and get a pneumonia, or falling and breaking a bone, and falling and or hitting your head. And those complications are things we try to avoid, because they're the things that ultimately will can cause problems. As long as we can prevent those from happening and make sure that swallowing is safe and balance and mobility is safe, we generally avoid a lot of the complications of Parkinson's disease. Over time, as patients are on medication, they may start to feel the medicines kick in and wear off. That's called motor fluctuations. So they feel good, and then they feel like their symptoms are back. And they can seesaw between those two states, and that can be disabling. Another problem is dyskinesia. So it's usually related to medication. When the medication kicks in, people get some wriggly movements. Sometimes they're mild, sometimes they're more dramatic. But they can be treated with certain medications. And the third thing is sometimes tremor is hard to control with medications alone. So for one of those three problems, deep brain stimulation is very effective. And deep brain stimulation is used now more and more frequently to help treat the symptoms of Parkinson's disease, specifically those three symptoms. And it's done in select patients where it's felt to be of benefit. Before medication was available, it really impacted survival, because basically patients are becoming very stiff, frozen, and bedbound, and then that wasn't a good situation. Now with medications to make sure that stiffness, slowness, and tremor is controlled and patients can maintain mobility, that has a huge translation into survival and doing well. So you're maintaining independence, trying to maintain as best a quality of life as possible. So everybody is different who develops Parkinson's disease. In some people it can be slowly progressive, or some people it can progress more rapidly. We don't have any way at the moment of predicting that, but there are patients with Parkinson's disease who've lived 20 years or more with the disease, and we're seeing that more and more.